Welcome to another lecture by MedicoMedics. So Genetics Chapter 13, Genetic Counseling and Ethical Issues. So in this lecture, we will have a brief overview over genetic counseling. When is it recommended? What are the steps involved? Some types of genetic testing, benefits of genetic counseling, ethical issues, and end with a summary. Now, genetic counseling is a communication process to help individuals and families understand and adapt to the medical, psychological, and familial implications of genetic contributions to disease. So key roles here include assessing genetic risks, explaining genetic testing options, and support decision-making. Who provides this? Typically genetic counselors, physicians, and trained healthcare professionals. So when is it recommended? Well, situations appropriate for genetic counseling include a family history of genetic disorders, doing a prenatal screening showing abnormal results, known carriers of genetic conditions, couples planning a family with concerns about inherited conditions, and diagnoses of a genetic condition in the family. For example, a woman with a family history of breast cancer may seek counseling to discuss genetic testing for BRCA mutations. What are the steps in the genetic counseling process? We start with an initial assessment, so collecting family and medical history, assessing risks for genetic conditions. We then move on to genetic testing, discussing options and implications. Conduct tests if necessary, like blood or saliva sample. Result interpretation, so we explain what the results mean for health and family planning. Support and decision making, so providing emotional support and helping with decision about prevention or treatment. So we have several different types of genetic testing. We have diagnostic testing, so identifying genetic conditions causing symptoms like Huntington's disease. We do predictive testing, so assessing the risk of developing a condition, like BRCA testing for breast cancer. We do carrier testing, identifying if someone carries a gene for a recessive condition, like cystic fibrosis. Prenatal testing, detecting genetic conditions in a fetus, like looking for Down syndrome. Newborn screening, identifying genetic conditions at birth. Now, what are some benefits of genetic counseling? Medical benefits include early detection and prevention of genetic disorders, informed decision-making about treatments or surgeries, emotional benefits, so reduced anxiety through understanding the risks, support in coping with genetic conditions, family planning, so it helps couples make informed choices about having children. So, for example, a family with a history of sickle cell anemia can plan for a healthy pregnancy using genetic counseling. Now, ethical issues in genetic counseling. So, privacy and confidentiality, protecting genetic information from unauthorized access. Who has the right to know family genetic risks? Informed consent, so ensuring individuals understand the risks, benefits, and limitations of testing. Genetic discrimination, preventing misuse of genetic information by employers or insurers, etc. Autonomy and decision-making, so respecting individual choices even when they conflict with medical advice. Now, genetic counseling and the future. Up-and-coming trends, so integration of genetic data into electronic health records. Advances in whole genome sequencing. Personalized medicine based on genetic risk profiles. What are some potential positive outcomes here? Well, it could prevent more genetic diseases and help people live healthier through tailored treatments. For example, in the future, genetic tests could predict and prevent diseases like Alzheimer's decades before symptoms start. So in summary then, genetic counseling helps individuals and families understand genetic risks and make informed decisions. Ethical concerns include privacy, informed consent, and preventing genetic discrimination. Advances in technology and personalized medicine are shaping the future of genetic counseling. That's the end of chapter 13. Continue now to chapter 14.